Have you ever added up the true cost of your birth control over 10, 20 years? Do it. The math is shocking. It's amazing how often a guy will balk at paying $1,000 for a vasectomy, but without thinking, doesn't add up the cost of condoms, birth control pills. It's thousands of dollars that you or your partner are spending on birth control. But the dollars are one thing. It's the hidden costs that are really going to get you. So what are the top hidden costs of other forms of birth control? Let's start with a big one, the side effects. Guys, talk to your female partner. There's a good chance she doesn't like being on the pill, doesn't like having cramping and bleeding from an IUD. Hormones don't always sit well with women. So ask her. And, listen, we all know women suffer in silence. They'll do everything. We just assume everything's okay. We got to kind of pry it out of them, as any guy who's married, and I fall in that category, knows. So that's number one. We all want our women to be feeling optimal as well, because guess what? They're going to feel more frisky. So get a little selfish about this. Number two is the cost of the stress. Guys, condoms break. I think probably every one of us have had that moment where we go, uh-oh, that fell off, that broke. And the complete and utter fear from that, I can say myself, is not a very good feeling. And that leads into the fact that all these other forms of birth control, the failure rates are much higher than a vasectomy. Now, we've all heard these myths about vasectomies failing, and yes, they can. But guys, if you do your homework, you do your sperm check at 2 months, the chance of a failure from a vasectomy is 1 out of 2,500 vasectomies. That's 0.05%. All the other forms are well above 1%. 1% may not sound much, but again, do the math. How often do you have sex? There's a pretty good chance that you're going to have an oops in the next year if you don't really play it careful. The last hidden cost is the cost of your time. We sit here and worry about the immediate cost of a vasectomy, but how much time are you or your partner wasting driving to Walgreens or CVS every month for the birth control pill, buying the condoms, going to the OBGYN office, sitting in their office for a while, getting your IUD changed, or waiting for your birth control pills to get refilled? These are real costs. And a lot of patients who come to see us at PazonaMD like us because we value your time. We offer same-day consults with the procedure, one visit, in and out. We don't even make you come back for the sperm check. You get to do that at home. So guys, when you start doing your pro formas and profit loss statements of your birth control pills, which I'm sure some of you guys are doing, take a look at these hidden costs because they're adding up more than you think. If you found this content today valuable, please click that little subscribe button. That way you're going to get notified as quickly as possible when we drop our next episode. So until next time, show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Thanks and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, PazonaMD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.